My name is Irina Murakhovskaya. I'm a classical hematologist in Montefiore Medical Center, Albert Einstein College of Medicine in the Bronx, New York. And my research interests are immune cytopenias, including warm autoimmune hemolytic anemia, ITP, cold agglutinin disease, as well as PNH. So anything that has to do with the immune system and blood. Warm autoimmune hemolytic anemia is rare, so it's hard to do clinical trials. The disease is very heterogeneous, ranging from mild asymptomatic compensated hemolysis to a very severe disease requiring blood transfusions and mortality rate of up to 10%. It's hard to do clinical trials, hard to find uniform group of patients, and that's why it's been so hard to treat. Currently, there is no available treatment for warm autoimmune hemolytic anemia. We've been using off-label medications, including corticosteroids in the first line, and rituximab in the second line, and in selected patients in the first line as well as other really old, non-specific immunosuppressants. And there's no approved therapy for warm autoimmune hemolytic anemia at this time. So the purpose of the trial was to see if the medication Nipocalimab will provide durable hemoglobin improvement in patients with warm autoimmune hemolytic anemia. This drug blocks the FcRn receptor, which is responsible for recycling of IgG, which is the main molecule responsible for red cell destruction in warm autoimmune hemolytic anemia. So we all have IgG, and 75% of the IgG that we have in our blood is not produced de novo, but recycled. And FcRn is the receptor that blocks this recycling mechanism. By blocking IgG recycling results in decrease of the IgG levels, both regular IgG as well as the pathogenic IgG. And the idea is if you reduce the number of the pathogenic IgG, you don't tag the red cells for destruction, and you improve anemia control in patients with warm autoimmune hemolytic anemia. Our other endpoints were reduction in fatigue, which is a very important patient-reported outcome. And really the most significant complaint that patients have when they're talking about their disease has a very negative impact on the quality of life. In addition, because many of those patients are steroid dependent, one of our key secondary endpoints was looking at the ability to reduce the corticosteroid dose while on this medication, which has been accomplished. The mean corticosteroid dose was decreased in patients on 30 milligrams per kilogram of Nipocalimab in the study. This is the largest trial, as far as we know to date, investigating warm autoimmune hemolytic anemia. What is the next step with this therapy in this patient population? Well, we're hoping that this will be approved therapy, and this will definitely provide an effective, safe option for this patient population. Currently, there is no approved therapy, so if it is approved, it would be the first approved agent in the space. And it would provide patients durable hemoglobin control, improvement in the quality of life, potential to decrease corticosteroids with a very favorable safety profile.